Let's talk now about those GABA A benzodiazepine sensitive receptors. But before we do, need to backstep just a second. Those benzodiazepine insensitive receptors are not brutes. Those are the ones that are involved in the extrasynaptic location of the benzodiazepine receptors, and they are involved in the tonic type of firing that keeps the tone of GABA, I think, at a constant, somewhat constant rate. Now, the benzodiazepine sensitive receptors, in order for them to be sensitive, they must have two beta isoforms. They must have a gamma isoform, and then if they have two of the alpha 1 isoform, these are the GABA benzodiazepine sensitive receptors implicated in sleep, and they are the ones that are targeted for most of the sleep medications, benzodiazepine and non-benzodiazepine sleep medications that we use. Then benzodiazepine sensitive receptors that have two beta, a gamma, and then two of either the alpha 2 or the alpha 3 are the ones that are more implicated in the anxiolytic effects of GABA, and this is what we will be talking about more with the medications for anxiety. Now, we said that there are the GABA receptors, and then there are the allosteric receptors on these 5 different subunits around that chloride ion channel. The allosteric receptors are the positive allosteric receptors, or PAMs. In order for a GABA receptor to work, GABA in and of itself can work, but a benzodiazepine without the presence of GABA on the binding site will not work. And so I kind of like to think of the PAM as a little bee that comes and helps the flower to do its thing. So when we have GABA on the GABA receptor plus an allosteric receptor for the PAM being activated, then there is a more frequent opening of the chloride channel. Not a wider, not a longer, but more frequent opening. And when the chloride then is more frequently entered into the cell, that increases inhibition, which leads to sedation and calm. When people take an overdose of benzodiazepines, unfortunately it happens, there is a benzodiazepine agonist, not a GABA agonist, a benzodiazepine agonist called flumazenil, and it's just important to know that that medication is out there. It would most likely be one very familiar in emergency room situations. Let's move on.